So we have dactinomycin, doxorubicin, daunorubicin, bleomycin, mitomycin C, and mitoxantron. Mitoxantron is an exception that it does not end with mycin or bicin. Next, we fill up the antimetabolites. We have three categories in this group: the folate antagonist, the purine antagonist, and the pyrimidine antagonist. We observe that most of the antimetabolites ends with the letter 8 ATE or purine or BINE bine. In folate antagonist, we have a drug called methotrexate. Folate and methotrexate sound similar, easy to remember. In purine antagonist, we have 6-mercaptopurine, fludarabine, and cladribine. Purine and 6-mercaptopurine sound similar, easy to remember. In pyrimidine antagonist, we have 5-fluorouracil, citarabine, capecitabine, gemcitabine. So we see that the drugs ending with BINE bine all fall in this group. Next, we discuss the C, that is camptothecin analogues. We have two members here, topotecan and irinotecan. Thecin and tecan sound similar, easy to remember. Next, we will talk of two groups together, the taxanes and the vinca alkaloids. Both of these drugs have a similar mechanism of action, that is, both are microtubule inhibitors. In taxanes, we have paclitaxel and docetaxel. Again, taxanes and taxil sounds similar, easy to remember. In vinca alkaloids, we have vincristine, vinblastine, and vinorelbine. All the drugs starts with the letters VIN, and the class of drugs also starts with VIN, vinca alkaloids. Easy to remember. Next, we will talk of the first and the largest group, that is alkylating agents. In this group, we have meclorethamine, cyclophosphamide, ifosfamide, chlorambucil, mephalan, busulfan, carmustine, lomustine, decarbazine, temozolomide, cisplatin, oxaliplatin, and carboplatin. The platinum analogues, that is cisplatin, oxaliplatin, and carboplatin, are sometimes put into the miscellaneous group, but they have many pharmacological properties similar to alkylating agents, so I have classified them under alkylating agents. Now we observe that most of the drugs starting with the letter C are alkylating agents, such as cyclophosphamide, chlorambucil, carmustine, cisplatin, and carboplatin. Last, we have the miscellaneous group. In this group, we have procarbazine, the epipodophylotoxin, that is etoposide, the hydroxyurea, the enzyme L-asparaginase, tyrosine kinase inhibitors such as imatinib, nilotinib, and sorafenib, etc., the proteasome inhibitors such as bortezomib. We will now look at the drugs affecting the hormonal milieu. Many cancers are either hormone responsive or hormone dependent. In the first case, that is hormone responsive, the tumor regresses by hormone therapy, and in the second case, that is hormone dependent, the tumor regresses by removal of the hormone support. So in this group, we have glucocorticoids, estrogens, progesterones, SERM or selective estrogen receptor modulators such as tamoxifen, toramifene. The SERMs I have already talked about in one of my previous videos. Then we have the SERDs or selective estrogen receptor downregulators such as fulvestrant, aromatase inhibitors such as letrozole, anastrozole, exemestanes, the anti-androgens such as flutamide, bicalutamide, the 5-alpha reductase inhibitors such as finasteride, dutasteride, and GnRH analogues such as nafarelin and triptorelin.